All right, it is 4 o'clock. I think that is a fabulous time to talk about stress and burnout, right? At the end of the day, it is me standing between you and happy hour. So hopefully, you stick around to the end. So as I was just introduced, I am Dr. Fredrick D. I reside in Los Angeles, California. Left out of that introduction. So today we're going to talk about stress and burnout and looking around the room. It's a very full session. So that means you all as administrators are seriously concerned about your staff, or you yourself are stressed and burnt out. I'm going to go with the latter. Because I am one of those administrators who has been stressed and has suffered from burnout over the course of my illustrious career in healthcare. Today, we are going to talk about these 5 objectives. We will define and differentiate between stress and burnout. What are the differences? How are they truly different? Specifically, what are the causes of stress and burnout in the healthcare setting? We'll highlight the impact of stress and burnout on the healthcare professionals' mental and physical health. I'll give you some practical strategies and techniques for managing stress in the workplace, and we'll offer some preventative measures to help avoid burnout and stress. So, to get an understanding of stress and burnout, a quick overview. Within the healthcare setting, there is a high prevalence of stress and burnout. This is due to key factors such as the workload. Some of us work in very busy hospital environments. The emotional demands of the work that we do, especially if you are working in critical access or cardiac cath lab, interventional radiology, where you are doing critical patients. And long hours. The symptoms of burnout: emotional exhaustion, depersonalization, and reduced personal accomplishment. You just start to detach from society. Now, the impact on the healthcare professional, this impacts your mental health. It leads to anxiety. That leads to job dissatisfaction. And now we have high turnover rates. How many of you are struggling right now trying to find CT techs? Wonder why I chose CT, okay? Think about what we've done, I'm included in this, what we have done to CT over the years as healthcare professionals. Ordering volume through the ED, everybody gets a CT, right? Which means we have to find ways to be more efficient. So what is the first thing that we do? I need to shorten that appointment time. You don't need 15 minutes. My time study says you only need 7.35. So I'm gonna give you 10. Right? That's how we have contributed to this, right? That's how we've contributed to the workload. Now, we need to take a proactive approach to readdress this issue because it's gotten urgent, okay? What COVID did, it highlighted all of the cracks in every single system that we have, right? Logistics, we couldn't get supplies, the lack of emotional support that we provide to our staff, or that we should provide to our staff that we don't, especially in times of crisis. So we had opportunities. We did not maximize those opportunities, and they left. Where are the CT techs? They're still out there. They don't want to work for us anymore. They don't want to do it anymore. We've burnt them out. So they're doing other things. They went back to X-ray, they went back to real estate, they've done other things. So we need to be able to support our healthcare workers, and this includes you. I'm including you as administrators in this category of healthcare workers. By implementing workplace support systems and mental health resources, we need to go beyond just the EAP. There's nothing wrong with EAP, but we need to look at what is the EAP offering and how can we add to that. We need to encourage work-life balance and resilience training, giving people those skills that they need to cope with the stressors of life. And when I say encourage work-life balance, I mean we need to also live it ourselves. So if you have a group text going right now in your department, and that includes people who may be off shift and you're texting all that. Let me just tell the story. So my sister's a respiratory therapist. I was trying to leave her out, but because I keep telling all her stories, but she's not here, so it's okay. She's a respiratory therapist. She lives in Austin, Texas, and I was visiting her one time. So she's off because I'm visiting, right? And she's grabbing that phone, and it's like every 20 minutes it's beeping, it's buzzing. I'm like, who is texting you? It's my supervisor. I've been here for 3 days. You've been off. You're off for like a week. Why is she texting you so much? She's like, well, there's a group text for the department, and this is what she uses to communicate things that she needs to communicate. So whether you're at work or not at work, she's just trying to make sure everybody gets the same communication. I said, oh, but you're off. None of this is urgent. You're not on call. You're not expected to be responding to this. And she's asking questions. Like, if you're doing that, you're not giving your employee time away from work, which is what they need. They need to unplug completely. So if you are doing that, or if your supervisors are doing that, you might want to check in with them and reevaluate this communication plan. What you need is a communication plan. How can I get this information to the staff in a timely manner and that's effective, other than a blast text message to everybody so you get it while you're on vacation or in the middle of your shift anyway? That's contributing to the stress, to the burden of the working conditions. The benefits of a well-supported healthcare workforce. If we had a well-supported healthcare workforce prior to COVID, they all wouldn't have left. Some of them probably would have, but not in the numbers that they did. We didn't prepare them before, and we certainly didn't appropriately care for them afterwards, okay? When we have a well-supported healthcare workforce, we have improved patient care and overall healthcare system efficiency. So, when you need to get more CTs done, okay, if you have a well-supported department, shortening the appointment length would not necessarily be the best option. And you would find a different option, which would be maybe you need a tech aide in CT to help with this patient flow. Maybe you need a nurse in CT to help with IVs and contrast monitoring and all that other stuff that we put on the CT tech to do in 7.35 minutes, remember? But we're gonna give them 10. Are there other things that we need to do to support the technologists in order to get the efficiency that we're seeking? Yes, it costs more money. And part of the reason we do what we do, the way we do it, is to be budget neutral. Trust me, I've been in those conversations. Find a way to do more with less, and no, you're not getting any additional money, but I need more CTs, okay? There's a cost to that. Job dissatisfaction, high turnover, because we have stressed out the staff. What is stress? Stress in itself is normal. It is your body's physiological and physical response to the environment. Okay, your body is designed to respond to stress. And so it's typical in the healthcare setting. It's normal. We have high demands. We have stressful situations, change in patient condition. That can elicit some stress, right? My patient's in MRI, in the scanner. Now she's not breathing. I've got to call a code, but I can't run a code in zone 4. See the stress? I got to get the patient out. I got to do all this stuff. Stress is normal. It's acute. That's an acute example of stress. It comes on, you deal with it, it should dissipate. The key is it should dissipate. The problem is it doesn't, because we go from one stressful situation to another. So we never gave the body a chance to dissipate its response. So it stays heightened. So you stay in that fight, flight, freeze response. So your body stays stressed. Now you're getting into chronic stress. Chronic stress, long-term persistent stress due to ongoing pressures of the healthcare system. I just had my code in the room. After a code, do you give your staff time to go and process, debrief? Is there a debriefing? Is there a emotional reset for them? One, I see one head. I gotta get the next patient. My outpatient is already, this is MRI. I've already had 3 outpatients waiting. This was an add-on ED, remember? Yeah, we don't work into the way we do our work, the support that the staff needs. I used to work in the cath lab at Cedars-Sinai 20 years ago. I was 22 years old. I had only been a rad tech for maybe 10 months, so still a new grad. Got hired into the cath lab. And no one prepared me emotionally for that environment. So this is Cedars-Sinai in 2003, which at the time had 800 beds. Now it's over 1,000 beds. Level 1 trauma center. It's on the west side. Lots of high profile patients come through there, even through the cath lab. I'd be violating HIPAA if I told you who some of my patients were, but you know some of them. And I'll leave it at that. No one prepared me for the emotional side. This is the cardiac cath lab at Cedars-Sinai. These patients have serious cardiac issues. There was a code every day. Every day. In one of these rooms, there will be a code. Sometimes caused by you. Because you're going in there, you're putting wires and catheters, and you're tickling things, and you're touching things, and you can hit a note, and you can send a rhythm off. So yeah, this is a high stress situation every single day. We worked 10-hour shifts, and then we were on call. So the week you were on call, you still worked your 10-hour shift, and you still had to come in call. So then that turned into a 80-hour, 100-hour work week. No one ever debriefed me after a code. All these patients don't survive the code. Some of them come in actively coding from the ED, right? Acute MI from the street and come up to the cath lab, and we're gonna do what we can do, and we can't get in there fast enough. It's happened. And no one came and talked to me about it. So think of the emotional stress that these people are carrying every single day, just doing their job. So when we say mitigating strategies of support, think outside the box, right? Can we pause for 10 minutes? Give them 10 minutes. Is there someone who can come from HR, EAP that can come and, so do we have a process for that as an organization, let alone as a department? Because the stress is not just happening to you in imaging, it's happening in the ED, it's happening in the OR, it's happening in all of these departments. So we want to recognize and address the stress that's inherent to healthcare. Burnout is a little bit different. Think of your car. You have to put fuel in your car, right, in order for it to go. So you gas up. And over the course of your life, your day-to-day business, you drive to work, you drive to the grocery store, you go to pick up the kids from soccer, wherever they go. So you're burning through that fuel. All those things that you have to do are stressors on that car, burning fuel to get you there. Eventually, what happens? The light comes on. There's a light that comes on that's giving you a warning that says, hey, you might want to do something because you're running out of fuel. Okay? So you encountering that stress on a day-to-day basis is you burning the fuel in your car. Eventually the light comes on. You get a cold and you don't normally get colds. You start getting headaches and you don't normally get headaches. This is your light coming on. This is your body telling you, hey, you might want to do something because you're running out of fuel. What happens if you do nothing? You keep going. What's going to happen to that car? It's going to stop. Wherever it is, the same thing is going to happen to you when you reach burnout. It's the point where you have run out of fuel. You are exhausted. This is where your body is going to force you to sit down somewhere. That headache now turns into migraines. The stomach ache is now reflux. You have ulcers. You now have physical health problems due to the ongoing chronic stress that has led to burnout. So, like we said earlier, stress is normal, especially in healthcare. We have a high demanding profession. We talked about acute and chronic stress and the differences between those. Patient care demands, high responsibility. We're placing a lot of this stress on the healthcare workers simply by the nature of what we do. So it's our role as administrators to be supportive and also incorporate how can I support you and help you manage the stress that we're placing you under, that we're all under. We have to acknowledge the importance of burnout because this is what has led to the staff leaving the profession. Now we have a shortage. 3/4 of the room, put your hands up because you're looking for CT techs. Dang, I wish I had learned CT. It's too late now. It's too late now. I've moved on from learning CT because I know what's going to happen to me when I go over there. I'm going to get my butt kicked on a day-to-day basis. Absolutely not. So this is why we need to recognize this, because the staff that is left, right? There are people still there that are feeling the effects of us being short-staffed, of our processes, of our workload that still have to be addressed. So we still have to acknowledge and we still have to tackle it. So when we compare the two, stress is a response to short-term pressures or demands. It's that fight or flight freeze response. Your body is responding to the environment that you are in. Burnout is a state of chronic exhaustion. You have moved so past acute stress. This is chronic. This is every day. It's a struggle to get out of bed. Every day you are exhausted. The causes. So stress is caused by immediate high pressure situations, that code blue that happens in the middle of your MRI exam. That will cause some stress. Burnout is going to occur in the long term, unrelieved stress. I'm keeping my body in that fight, flight, freeze response. This is often due to systemic issues. And we've talked about some, right? Maybe we've got processes that we need to improve. Maybe we've got support staff that we need to consider incorporating into the department in this modality. Maybe I've got workflow considerations. Maybe the physical layout of my department is trash and that is why I can't get my stuff done. I've had one of those departments. right? I've got no space to build out. I've got no space to put the support people where I need them, to get them out of my CT scan room so that I can do 10-minute CTs with ease. There's other things that I need to add to it. Symptoms of stress and burnout. So your stress symptoms can be both mental and physical. So you have anxiety, irritability. It can cause some short-term fatigue. Physical symptoms, those headaches, stomach pains. It can manifest in muscle aches in different parts of your body. Burnout goes further, and this is emotional exhaustion. You have next to no energy for anyone or anything. This is problematic if you don't live alone, I would think. I live alone, so it was just me and my dog, and it's easy to ignore a dog versus ignoring a spouse, I would imagine. You have a spouse, you have children, you have other family that you may care for, other things that you have to do, and you've lost a desire to do them. This is an indication that you are probably reaching burnout. You have no outlet to relieve yourself of stress. Okay? There's no attention being given to the systemic issues that are causing your stress. You're just on a daily basis continuing to burn through all that fuel. The duration. So stress, acute stress, it'll come on, it'll get resolved, short-term solutions. Short-term solutions. A short-term solution to a stressful event could be taking a walk around the building, some deep breathing exercises. If you have therapy scheduled, a therapy session to talk about it. These are good short-term solutions to those stressful events. Burnout. This is chronic. It develops gradually. So the problem with burnout is you don't realize that it's happening until it's already happened. You're already in it. You're already exhausted. Now you got to get out. Now you got to get out because you left the light on too long. You missed the warning signs. Now you're in it. And it's going to require long-term strategies. So 1 or 2 therapy sessions is not going to do it. You're going to need a series of sessions, depending on how deep the mental effects have gone. How deep are you in your anxiety? How deep is your depression? Sometimes the burnout can lead to PTSD. Who has ever heard of PTSD from the workplace? Okay, that's more than I imagined. Yeah, that is a real thing. News to me. But yeah, and again, you don't recognize that the burnout is happening until you're already in it. So the key is to recognize the stressors and the chronic stress that you're dealing with, and to incorporate into your work life uplifts and little things that you can do to balance that out. Stress is the precursor to burnout. Like I was just saying, you've got to recognize that you are under an extreme level of stress because the burnout is going to build gradually over time. Strategies, time management. You've heard that before. Time management. You have to be able to, it's about understanding what's in your control and what's not. Time is not in your control. We all have the same amount. We're all given 24 hours in a day. What you do with it is what you do with it. Well, 8 of it we need to sleep, so they say. Okay, so you got to carve out some sleeping time. You've got to carve out time to go to work. Okay, well, I only have 8 hours at work, and I have 10,000 things to do. So I can't do 10,000 things in 8 hours. So what must I do today? What can I do tomorrow? What can wait till next week? This is how it starts. If you have no idea how to start time management, what can you accomplish today in the next hour? Well, I can call these 3 people and try to move this initiative forward. Okay, then do that. It's helpful if you write it down. Now you're creating a plan for your day, a plan for your week, a plan for your month. So you know everything that you're supposed to be accomplishing and getting done. Now, the key to doing this is being flexible when you don't get to check anything off that you plan to do that day. Another source of stress for those of us who suffer from not being able to check things off of our list. Yeah, I'm one of those people. When I make a plan, I want to stick to it. And so distractions, I know, create stress. So I know I need to work on my flexibility in my time management. You have to understand who you are. Self-reflection is key to this. Know what stresses you out, your quirks. Do you have OCD? Lean into it. You've got OCD. Recognize that you've got it. Recognize how it shows up at work. Now you can manage it. Are you dyslexic? Recognize it. Lean into it. That means you're going to need more time to read reports than maybe a different administrator. So you need to work that into your time management plan because you know what you need. Okay, these are the things that you can control. Burnout. So because burnout is much deeper, it's going to require deeper strategies to prevent. You may need organizational changes. You just need a new boss. I've been there. Or you just need to go work somewhere else. Now, those of us who work in large metro areas, I live in LA, I've got my choice, right? If I want to leave Kaiser Permanente, I can do that. I've got UCLA, I've got USC, I've got Cedars. I've got options. Some of you are in rural areas where you don't have those options to change your organization. So can you adjust your workload? What can you do within that organization to make some changes or to influence change? Can you seek psychological support? I cannot stress how important psychological support is. I swear by it now. I swear by it. It is probably one of the single most greatest things, that's terrible. It is probably the single greatest thing I have ever done, which is go and get psychological support. It is, no pun intended, mind-blowing. Thank you for laughing. I know her, that's why she laughed. So we've been talking about causes of stress among our imaging professionals. A lot of it is work-related. Our patient loads, right? How intentional can we be with revising our workflows? How intentional can we be with handling the volume of patients that are coming through our department? Are all of those patients even appropriate? Are all of those exams even appropriate? See? Does everybody in the ED need a CT? No. Right, so how intentional are we going to be with driving an imaging appropriateness initiative in our hospital? Right? Do we have physician support for such a thing? Are the executives on board? Have I built a case for it if it doesn't already exist? Right? These are the impactful changes that we need to look to that can help support our department, we as administrators. Is there a high exposure to suffering and death? Do I work in a critical access department, critical access hospital? Is this trauma, is my staff being exposed to dismemberment and carnage all the time? I mean, I don't know what's happening in your hospital, but what is the acuity of these patients? What's happening to them, right? And how is that affecting your staff? Because there is an emotional component to the work that we do. Personal causes, work-life balance. You as the administrator, are you truly allowing your staff time to disconnect from the workplace? When they're off, are they truly off? Or are you reaching out to them like my sister's supervisor is, with frivolous, non-urgent, this can wait type stuff? How about your supervisors, your assistant directors? Are they doing any of this? Do you even know? You might want to check. You might want to check. If you've got a large department, I can tell you there are text message threads going on, some official and some unofficial. But yeah, we want to make sure that we as administrators are not contributing. So when we say that you're off, you're truly off, and we're not disturbing that time off. Health concerns, personal health issues exacerbated by job stress. Do you recognize that CT is stressful? Do you check in on them? Do you recognize that some ultrasound exams are physically more demanding than others? So putting them back to back physically adds stress to my ultrasound tech, right? What is it? I think OBs can be physically demanding, depending on your protocol, wherever you are, for your shoulders, your wrists, and things of that nature. So have you looked at your scheduling template to see how can I spread this out so that it's not falling on whoever's in room 5, right? There's one OB in every room in the morning, one OB in every room in the afternoon, however you want to do it. But take a look at that. The nature of the actual exam, is it burdensome that I need to spread this out amongst my staff? Environmental causes. Do I have inadequate resources? Am I doing my diligence as an administrator in identifying the resources that I need and having the appropriate conversations upstairs? Am I going to the executives telling them, you didn't give me enough? Am I saying it like that? Hopefully you are. Be assertive, right? You've got to go up there into those finance meetings with assertion. No one, trust me, trust me, no one in that building knows diagnostic imaging more than you do. They don't. They think they do, but they don't. You know it. You know what works, what doesn't work, why it can and why it can't. You just have to tell that story when you go up there and bring the right information. This is how we support the staff. Are we doing our diligence as administrators in identifying what they need, and are we asserting ourselves for them? Okay? So the impact of all of this, if we do nothing, we maintain the status quo, we're going to have a cumulative effect on the work, personal, and environmental stressors. So we've got to mitigate this, developing those robust support systems within the workplace. As we move through the current CT shortage, I should say imaging professional shortage, there's new grads, coming every year. We want them to stay. So we still need to do something about the way we approach the work that we do in diagnostic imaging so that we don't continue to contribute to the problem. And the new ones that come in, we're able to retain them. We want to encourage work-life balance and live by it, be examples of it. If you have assistant managers or supervisors in your department and you come in and you see that they were emailing you last night at 10 o'clock at night. If my philosophy as a leader in the department is work-life balance, I want to have a conversation with you and say, hey, I would much rather at 10 o'clock at night you not be sending emails. It can wait. I'm not going to see it till 8 in the morning. So why are you sending it at 10 o'clock at night? I'm not going to look at it. I've had to do that. Stop doing that. I don't want to see an email from you again at 11:30 at night, ever. Now, this was pre-pandemic. This was pre-pandemic. But I'm like, there's nothing that my assistant director should be doing at 11:30 at night. You're not on call, you're not working. I mean, send it when you get to work. Yeah. That's how you support it. You reinforce it to them. Like, hey, I don't want to see it, so there's no sense in you doing it. Enjoy your evening off. The impact of these stressors. You may need to address some of these factors through policy and resource improvements. Okay? This is your advocacy and assertion for your staff upstairs, for the support roles that you need, for the additional equipment that you need, for a remodel of this horrible hospital that you need in order to reduce these work stressors. Policies. You may need to go so far as to write out a communication plan policy for your department so that your ADAs and supervisors are not doing these text threads all into the evening to everybody, whether they're at work or not. Hopefully you don't have to, but you want to create that culture. You have to support the culture. And if you need to change it, this is one way we do that, is we write policies and educate people to it, and we go through that whole process. And you may need to do that, and that's okay. Because again, this is on behalf of yourself and your staff. So, the causes, work-related causes of burnout among imaging professionals. We've overworked them. There's a lack of control over the work. So if I come in, I have no say in the protocols, I have no say in the workflow, they're not listening to me when I tell them that I need a tech aid. It's just, think of what that would do to a person. Think of what that would do to you if your VP never listened to you when you communicated your needs for resources. You feel powerless. You feel powerless in decision making. You have no control over your job autonomy. You're gonna start to lose your interest. This is gonna put you on a path to being burnt out. Do you have the proper support, and are you giving the proper support to your staff? Insufficient rewards. Do you have a reward and recognition program in your department, in your hospital, in your system? Is the staff recognized at all for anything? If the only time you speak with the staff is in front of a union member when they've done something incorrectly, that's a problem. That should not be the only time that we sit down with staff for corrective action. There should be some positive conversations worked in there where we acknowledge their effort and their achievements. How about poor team dynamics? Do you have a situation where one modality will call an inpatient down, do the exam, and send it back up, not realizing that they also needed a CT? That doesn't still happen, does it? So that's poor team dynamics, right? You're bringing an inpatient down. Is there any other imaging exam you're gonna have? Let's coordinate it together. Especially if you're NPO for something. Let's get that done first so that you can eat, possibly. So poor team dynamics, challenges arising from the dysfunctional team relationships and poor communication. You know, modalities not talking to each other and not helping each other out. Personal causes, perfectionism. Are you the type of administrator where everything needs to be perfect? That creates stress. Everything is not going to be perfect. You are not perfect. Your department is not perfect. And the sooner we recognize that, the sooner we can start addressing the stress. Lack of coping skills. This is where that resiliency training comes in. Do we need to have coping skills? Inadequate mechanism to manage work-related stressors effectively. No one ever taught me how to handle the stress in the cardiac cath lab. So I had to figure it out. I had to look and see, well, how are they behaving, right? That's usually the first thing that we do. If they burst out in tears, then I know it's okay for me to burst out in tears. So if I need to, I will. That's how it works. But it would have been a lot easier or more helpful to me if someone had coached me or talked to me about it, maybe during orientation, maybe at my 90-day review, maybe my annual review, maybe after one of those codes. Coping skills. Inadequate self-care, neglecting personal health and well-being. Are you the type of person that needs to be the martyr? You've got to take one for the team. So I'm gonna stay up all night and work on my budget. I'm gonna stay up all night so that when I come in the morning, I can hand it to my VP. It's done. Are you that type of person? Do you need to stay up all night to do your operating budget? Is an operating budget that important? No. Not for you to be sacrificing your sleep. It can wait. It can wait. So recognize when you're neglecting your personal health and well-being amidst your professional demands. Environmental causes. Is your work culture toxic? Y'all didn't say nothing. That means it is. Is it truly toxic? Are you trying to lead through negativity, unsupportive executives, infighting between departments? Does the ED director hate you? I mean, all of these things contribute to toxicity in the workplace. And identifying that is step one. Number two is, I've got to do something about it. Lack of organizational support. Are you asking for help and not getting it? Are you reaching out for a hand and grabbing nothing but air? Is there a need for more backing from your upper management or from the organization itself to support you and your staff? Back to insufficient resources. That's important. If you're gonna stay up all night to do your operating budget, make sure you've identified all of the gaps and you go up there with assertion and you tell them what you need. And you show, because you stayed up all night, so you need to make it worth something. So hopefully you have all the data and the charts and the graphs that you need to show what's gonna happen to you next year if you don't give me $5 million more, or whatever it is. Because it's there, trust me, it's there. It's going to surgery, you know that. You know that. You know that. The surgery and the ED, they get everything. That's where the robots go, right? They're in the OR, they're in the ED, they get the robots first. Yeah. That's where it's going. So get in line with your pocketbook and put your hand out on behalf of your staff, because there's an impact to this, and we're already feeling this. These stressors uniquely affect the mental and physical health of your imaging professional, of you, right? This will lead to physical health problems if you do not address the chronic stress and burnout. The unique thing is, we're not just customer service, we're patient care. So that's a different kind of service. And when I'm feeling icky, exhausted emotionally, can you expect me to give an exceptional level of patient care service? You can expect it, but you're not gonna get it. You're not gonna get it. Are you struggling right now with your patient experience scores? Okay, Wendy. I'm gonna look at those tomorrow. But if you're struggling, unlike Wendy, who's not, if you are struggling, it could be your staff is simply not emotionally full. Their tanks are running low. And we need to tap into that, and we need to help them out. Strategies for addressing. So, creating a work culture that's rooted in positivity. Looking at your rewards and recognition program. Looking at the way you all communicate with each other. Look at the way that you approach problem solving, okay? We used to call it soft skills, or they still call it soft skills. To me, they're people skills. Are you assessing the people skills of your staff in your department? Because this is where your opportunities are going to be to address the impact of burnout. The physical symptoms. If you are suffering from stress, frequent headaches, frequent persistent headaches, dizziness can be associated with that if that headache has been prolonged. Muscle tension, cramping, your neck is sore in the shoulder area, maybe in the low back. Fatigue, you're just constantly tired, but you haven't physically done a lot, but you're physically tired. And the key to this is the tiredness is not alleviated when you take a break, right? You're exhausted, you're able to catch a nap on a Saturday afternoon, but you're still exhausted. You still have no desire to do anything. That's the difference, okay? Gastrointestinal problems, GI issues, okay? Stomach pain, stomach cramps, constipation, diarrhea, all sorts of these gastrointestinal issues can manifest out of stress. Psychologically, we talked about anxiety. You have this persistent worry or nervousness, and it's related to work. You're constantly thinking about work, and when you do, you can't stop. Irritability. You're quick to frustration or anger in professional settings. You're snapping at people in meetings more than you normally do. You're having mood swings. And see, this is where earlier when I said self-reflection is key, this is not your normal behavior. So you've got to recognize, wait a minute, I'm acting out of character here. So that's where the self-reflection comes in. Difficulty concentrating, challenges in maintaining your focus on tasks. The reason you had to stay up all night is because you couldn't focus to get the budget done during work. These are psychological symptoms that you are under stress. Changes in your sleep patterns. You have insomnia, can't get to sleep, can't stay asleep, or the opposite. You're sleeping too much. That's from the exhaustion. You're withdrawing from social activities. So now your stress is moving into burnout. Now, you no longer want to go out with your friends. You no longer want to participate in book club. You're not doing your needlework or whatever else that you do in your spare time. You're withdrawn. You have decreased productivity. The quality of your work has changed. Last year, you were able to whip that budget out in 2 days. Now it's been 2 weeks and you're still not done. Is it budget season? Maybe that's why it keeps popping in my head. Stress management. So you want to develop techniques to manage your physical symptoms of stress. You've heard this before, diet and exercise. That's not new. I know. There is no injection for stress management yet. Diet and exercise. You've got to get the right B vitamins. They help give you energy. You've got to get the right mix. And exercise is how you dissipate the stress. It's how you get the tension out of your muscles. It's how you work through, your body flushes out the hormones that were released. Exercise. You were put into a fight or flight response, but you didn't fight or flight. You just sat there, right? You were just sitting at your desk. So it would be a good idea when you get off to go to the gym, punch a bag, run on a treadmill. Now you fight or flight to get it out because your body prepared for it, but you didn't give it what it wanted. So go to the gym to help dissipate that. Making sure you take time for yourself. You know, when you travel, you get the safety briefing in the beginning, and they always tell you what? I gotta put my oxygen mask on first before I even put it on my kid who's sitting right next to me, right? Because what happens if I don't? I may pass out, but I'm trying to help you, and I may pass out, but now none of us got a mask on. So you've got to take care of yourself. You've got to make sure that you're all right in order to then turn around and make sure that your staff is all right. Okay? We don't need to be martyrs anymore. We don't need to, and I was from that school of thought to where, okay, I'm the department director. I'm responsible for everything. I'm in control of everything. I've got to take on everything. I've got to deal with everything. And I had assistant directors and I had supervisors, and I'm like, that's not sustainable. Yes, the responsibility may end with you, but you can only control so much, even as the director, even as the leader. And you have to recognize what you can and cannot control and then deal with it appropriately, because not doing so is what's leading to stress and burnout. For burnout, the physical, psychological, and behavior symptoms are simply more extreme. Chronic fatigue, frequent illness, okay, being sick all the time where you normally don't get sick. Changes in appetite, those changes in your sleep habits. Now you're eating more or eating less than you normally do. Some of us eat more. Psychological symptoms, your feelings of cynicism, detachment. So you're getting deeper and deeper into your burnout. And now you're withdrawing from responsibilities, not just the things that you enjoy to do. Now you're withdrawing from things you're supposed to do. You forgot to go pick up your kid from school. Right? Because you're just that exhausted. Like you're suffering from short-term memory loss. That's one that's not on there. Right? So now your responsibilities are becoming neglected. So you've gone way past your light being on. We've got to prevent this. So preventing burnout lies first in recognizing the symptoms of stress. Recognizing that you are in acute stress and moving into chronic stress, and recognizing that you need to have physical outlets of these stressors. That's where the exercise comes in. Taking a walk. It doesn't have to be strenuous. It should be non-strenuous, non-competitive, because you don't want the exercise itself to create more stress. You know? So, and again, taking care of your mental health, seeking help. If your elbow was hurting, you'd go see an orthopedic physician. Your emotions are hurting, you should go see a psychologist, psychiatrist, if you need medication. This is where you get the resilience training. That's where you're going to learn the coping skills from the trained professionals. The immediate physical health, physical effects, we talked about long term. This can lead to chronic disease. Now you've got chronic hypertension, you've got ulcers, they could be perforated, and you've got chronic issues. We talked about some strategies for managing stress. We talked about exercise, relaxation techniques, being able to learn. There's breath work that you can do specific to relaxation, and it's not just, take 5 deep breaths. There's a whole process of relaxation breathing that my sister, who's a respiratory therapist, could teach you if she was here, but she's not. Promoting a healthy lifestyle. Again, being the example that you want to see from the staff. If you don't want your assistant director sending emails at 11:30, guess what? You shouldn't be emailing them at 11:30, right? Otherwise, now you're a hypocrite, right? So you don't want to do that. You want to be the example for the others. It's similar for burnout and for preventing burnout. The prevention for burnout comes from recognizing the stress up front. That's going to be your indicator. If not, then recognizing when the light comes on, because as I mentioned earlier, burnout occurs, and then you realize it once you're in it. And the whole key is prevention, and we want to prevent burnout. So, we want to understand the nature and the cause of stress and burnout. We want to recognize the symptoms, because it has a phenomenal impact on our mental and physical health. And strategies for managing it is how we reduce these effects, because it goes through cycles. You could be at a period in your career where everything is smooth sailing and you're ascending, and then all of a sudden you hit a point and now there's been a change. You get a new VP, you get a new CEO, there's something that happens above you that changes the culture. Have you been there? And now you're moving into burnout. So this is why learning those coping skills is extremely important. So we want to make sure that we are adopting strategies that embrace and integrate stress management into our workplaces, into our organizations, and into the industry. And the final reminder is this takes a collective effort. Tackling stress and burnout is a joint effort between you, the staff, and the upper management in your organization. Each step to manage stress and prevent burnout contributes to a stronger and healthier workplace culture. That is all we have. This is my contact information. Do we have time for questions? Do you have questions? Where is happy hour? Is that the question? I think there are multiple bars to choose from. My drink of choice is an old fashioned. I might be having one. Are we good? We're good. That's it. Thank you.